I'm Dr. Richard Robles. I'm a board-certified chiropractic physician, specialized in using functional, metabolic, and neurologic treatments to help people with chronic conditions like diabetes get their life back. I'd like to thank you for watching my presentation today. We're going to talk about what diabetes is, how you get it, what it does to your body, and how you get rid of it. And we're going to try and squeeze that into a short amount of time. If you have diabetes, you know that it has to do with your body's ability to regulate and maintain its blood sugar level. Now, when you eat a meal, your body breaks it down into small little pieces. One of those pieces is called glucose. Glucose is your blood sugar. When we're measuring your blood sugar, we want to look at it on the following scale: 65 to 126. If you have less than 65, that means you have too little glucose in your blood, or you're hypoglycemic. If you have greater than 126, we know that you have too much sugar in your blood, and that's where we start to worry about things like diabetes. Now, this scale can change from lab to lab. It just depends on where you get it done, but these are pretty close to what the standard parameters are going to be. Now, the reason that this affects your body is because your body needs a few things to make your brain work correctly. And when you don't have the right sugar, your brain can't work correctly. The most basic unit of your brain is going to be your neuron. And your neurons, basically what they do is they send signals out to your body to tell it what to do, whether to raise your hand or lower your hand, whether to speed up your heart, slow down your heart, whether you need to produce more acid in your stomach or less, whether you need to move your bowel movements through your intestines to evacuate them, the sensation you feel in your hands and feet. All of those things are controlled by your neurons. And the neurons need three things to live and thrive. Number one is going to be stimulation. If you stimulate the neurons, then they grow and they start to increase in their function. If they don't get stimulation, they stop working so well. The second thing that they need is fuel, and fuel comes in two forms: oxygen and glucose. Okay? Your body needs oxygen and glucose in order to bring those into the cells to make energy. If your body doesn't bring the oxygen into the cells, it's not going to make energy. If it doesn't bring the glucose into cells, it's not going to make the energy to fire these neurons. And you're going to start to see there's problems that have to do with neurologic symptoms, whether it be an increased predilection towards sciatica, or numbness or tingling in the hands or feet, fungus in the nails, the nail beds. That's typically a sign of decreased nervous system function to that area. So what does this mean for you? Well, when we look at this scale from 65 to 126, you might say, well, that's a very large scale. Sometimes you fall towards one end, sometimes you fall towards another. What we want to see in this office is we want to see that your blood sugar stays between about 85 and 100. When it falls outside of these ranges, we know that we start to see the first symptoms relating to blood sugar. This area here, between 100 and 126, is what we're going to talk about first. Now, remember we said that your body breaks things down into small pieces, and one of those small pieces is glucose. That glucose, when it's in your blood, your body does not use it to make energy. It has to take this glucose and bring it into each one of these cells in order to start producing energy so it can fire these neurons. Now, when you have too little sugar in your blood, then you're not going to have enough to get into these pads to fire them correctly. If you have too much sugar in your blood, what will happen is the signal that your body uses to tell it to bring the sugar inside, which is insulin, that starts to your body stops responding to it, or it doesn't listen to it. It becomes resistant to the signal of insulin to say, bring that glucose from the blood into the cells so we can make more energy. This area of insulin resistance is typically where we see your blood sugar start to raise, and it's typically going to be between 100 and 126. If you're insulin resistant, some of the symptoms that you will see is that you fatigue after a meal or you get sleepy. Getting sleepy after a meal is not normal, it's actually a symptom. And those symptoms are very important to figuring out how we can help you get rid of your diabetes or correct your diabetes. So insulin resistance is when your body stops listening to the signal to tell glucose to come into the cells so you can make energy. The other end of this spectrum, hypoglycemia, you can be hypoglycemic and have high blood sugar levels because you get these levels measured at one particular point in time. It doesn't tell you what's happening throughout the day. So if you eat a meal where your blood sugar goes up really high and then it's allowed to spike really low, that's what we call reactionary hypoglycemia. That can happen from a meal, and usually what we're going to do is we're going to look at the symptoms that you have to see if you have that type of problem. If you get irritable or you have trembling or shakiness in between meals, that's a sign of hypoglycemia, and sometimes it can be reactive hypoglycemia. That's not normal either. Normally when you're hungry, you should feel hungry, you should eat, and then you shouldn't be hungry. But getting sleepy, getting irritated, or getting shaky between meals is not normal. So what do we do to fix this? The first thing that we need to do is we need to correct your diet and lifestyle to help regulate your blood sugar into a normal area. The second thing we need to do is sensitize your body to insulin if it's having a problem with insulin resistance. How do we know these things? Well, we run tests. And these tests do more than just tell us about your diabetes. They help us figure out if there's other things that are contributing to your diabetes, which is why you can't recover or even why you got it in the first place. The next thing I'd like to talk about are the deal breakers. These 6 things can contribute to your diabetes, or they could have caused it in the first place. If they're not dealt with, then you can still have diabetic symptoms even though your blood sugar might start to normalize. The first thing to see up here is autoimmunity. Autoimmunity is when your body attacks its own tissues. If that's a problem, then we need to help modulate and regulate your immune system to correct that. The most common places that you'll see that autoimmunity will be related to diabetes is going to be with thyroid conditions and also attacking of the pancreatic cells, or something called pernicious anemia, which is going to bring us to our next topic here, anemia. Anemia, that affects your body's ability to carry oxygen because it affects the size and shape of your blood cells. Your blood cells' job is to carry oxygen to the different tissues in your body so that they can fuel or fire these neurons and make energy. The third thing you're going to need is to address is your blood sugar. Okay? Since you're diabetic, you know there's a blood sugar issue. But if you don't know that that affects your adrenal glands, then now I'm telling you, anytime you have a blood sugar problem, it always affects your adrenal glands. And this is for people with diabetes, without diabetes, people who are on the edge. These adrenal glands are paramount in making sure that you can recover from the problem. The next is liver and gastrointestinal. This is where the conversion of T4 to T3, which are 2 different thyroid hormones, occurs. It's about 80% of your conversion of T4 to T3, or the activation of your metabolism, occurs inside of your liver and your intestines. If these areas are problematic, it can cause dysregulation of your body's ability to manage and maintain your weight, your energy, and also your body temperature. Your essential fatty acids, those are the basic building blocks for hormones. And remember that every single cell in your body is wrapped in cholesterol. So fat is important, it's just making sure that we get good fat into our body that's important. Essential fatty acids are decreased from things like fast food because of hydrogenated oils, partially hydrogenated oils. Those things are not good for your body's regulation of this essential fatty acid level. What is good for it? Raw nuts, and remember peanuts are not nuts, so stay away from peanuts. You'll also see that fish is a great place to get essential fatty acids. Avocado is another great place. Food sensitivities. Food sensitivities cause inflammation in your body. If you don't know that you're allergic to gluten or wheat, if you don't know that you have a problem with dairy, we need to figure those things out right away so that you can eliminate them from your diet and start making changes to your body so that you can start to regulate your body's ability to manage its energy level. If you have inflammation in your body, it definitely decreases your body's capacity to manage its blood sugar. So these deal breakers are paramount in ensuring that we can help you with your diabetes. So I want you to think about a few things. Has your health gotten better or worse over the last month? Has it gotten better or worse over the last year? What about the last 5 years? They say the best predictor of where we're going in the future is what we've done in the past. If things haven't been improving, or they haven't been improving at a level that you'd like, I encourage you to call my office at 909-949-0155. We'll help you get to the bottom of what's going on with your body. When we address these deal breakers, we look at your blood sugar, we look at your other metabolic tests, we can figure out what's wrong with your body and give you a plan and a strategy to help you recover. Thank you. I'm Dr. Robles, and I look forward to seeing you soon.